I like to make sure the community understands is sort of how the club has evolved and who we're serving. The club really, we like to say we're there for the children who need us most, but we're really there for all kids in the community. But the primary user of our clubhouse after school are kids that are coming from households that are what we kind of classify at $45,000 a year or less. So we tend to serve a lot of lower income families, families that are in school, having their kids at the club while they're trying to finish their education. So we have a pretty broad range of the different kids that we serve across Corvallis. So for the Ken Johnson Dental Clinic, and it was established in February of 2008, and to date, and every time I state a number, it just keeps growing. So we just say that now they've served well over 3,000 kids, and they've expanded into pregnant women across the community. The cost and the value of the services that have been delivered have been well over $3 million in dental services that have been provided. We do this through a partnership with Benton County Health Department. So what we've done is Boys and Girls Clubs created a dental access point, and then we have partnered with the Benton County Health Department, and they're folks that are the experts in providing dental care. We've been partnering with Benton County now for, I don't know, probably 4 years. The really exciting statistic, I don't know if you can see it up here, but they've been tracking the number of emergency room visits at Samaritan. And last year, they tracked about 350 people that were coming to the emergency room for dental treatment. And of course, they can't really do anything for somebody in a dental emergency. They can give them a painkiller, an antibiotic, and then they say, you just need to go find a dentist, find somebody that can help you. Because of the dental clinic and our ability to provide access, they've been able to drop those emergency room visits from 350 down to 159 visits year over year. They tell us that each one of those visits costs the hospital about $1,000 per visit. So alone, the contribution in sort of helping one solve the dental crisis for people that really don't have access to dental care is huge. And of course, there's a big savings to all sorts of people to get their dental care taken care of. And then we've done some really fun programs. I don't know if you know, we have a kindergarten program at the Boys and Girls Club. And so we started a program called Kinderbrush, where we bring in OSU students from public health, and we have them actually do a 6-week little education class with kindergartners. So we teach them how to brush, we talk to them about nutrition, talk to them about what, soda and things like that will do to their teeth. We start them out with a good old manual toothbrush, and then we move them to the electric toothbrushes. And in case you want to know, the electronic toothbrushes are the way to go. So those ones really work well. We ran together to bring services, a very targeted program to the kids at Lincoln School and in Garfield. And so starting on September 4th, we're going to be providing very affordable after-school services, primarily targeted at lower-income families, but really for all kids in that school. And we'll be bringing in programs and services, so things like STEM, the science, technology, engineering, math type programming, swimming lessons, art, music, things that a lot of the kids at Garfield and Lincoln don't generally get access to. We'll be able to bring those programs to the kids in that school. So the total value on this grant is about $1.6 million. It's huge. We were one of 20 organizations that received one of these Department of Education grants. It is a grant that lasts for 5 years, and so you get 100%, so it's basically $375,000 a year for the first 3 years, and then it drops by 25% and then 50%. And the goal, of course, is to get to the point where you've got a sustainable funding model so that you can continue to provide the services to the kids well beyond the granting window.